For that, to matters health, the National Syndemic Diseases Control Council, NSDCC, held a two-day summit focused on sex and sexuality for people with disabilities, marking a crucial step towards healthcare inclusivity. The summit highlighted long overlooked issues, including gender-based violence and access to services, while pushing for greater representation and tailored health solutions for people with disabilities. Anne Odida with more.
The National Syndemic Diseases Control Council's two-day summit on sex and sexuality for people with disabilities marked a critical turning point in addressing long overlooked issues of healthcare inclusivity. For years, people living with disabilities had been marginalized, particularly in decisions impacting their health and well-being. The summit declared that this group will no longer remain passive recipients of healthcare policies, but instead demand an active role in shaping those decisions.
How can it be addressed? Because if people with disability are associated with sex, to the public of the society, it seems it's something abnormal.
So our call to government is to ensure inclusion in decision-making spaces, especially in health and HIV prevention. We want to be included in the conversation. We want our ideas to be captured because we are the shoe wearers and we know where the shoe pinches.
Dr. Ruth Libon-Masha, CEO of NSDCC, emphasizes growing demand for inclusion, underscoring how essential it is for people with disabilities to have a voice in decisions that affect their lives.
We have been looking at our data gaps. We have serious data gaps on the HIV response, close to 40 years of our response, and we cannot confidently stand here and tell you the numbers of people with disability that we are serving.
One of the summit's key revelations was a significant and often a hidden burden of gender-based violence faced by men with disabilities.
Men who have their spouse without disabilities, there's a lot going there. We talked about gender-based violence. It has not come out to talk about men with disabilities.
Access to healthcare services, particularly for HIV, STIs and TB, has long been a challenge for many. However, for people with disabilities, these challenges are exacerbated by structural, physical and informational barriers. Health Principal Secretary Harry Kimtai stressed that universal health coverage USC is meaningless if entire segments of the population are excluded.
Our most important goal is as we roll out universal health care coverage, no one should be left behind.
Innovative measures like the proposal to create braille-marked condoms for the visually impaired were discussed as steps towards ensuring greater inclusivity.
So I expect this to be a policy decision by the ministry, and we'll take it up. We have picked it as one of those very critical policy that we need to make a decision on.
The Ministry of Health also announced that it is taking further steps towards inclusion, including incorporating assistive devices and providing health packages for people with disabilities through the Social Health Authority SHA. However, the ministry admitted that precise data on how many individuals with disabilities had registered under SHA was still lacking, and efforts to encourage their participation remain ongoing. Anne Odida, TV 47.